Welcome back. We have a number that you can call. We're talking about glaucoma. You could call and ask your questions. The number to call is 0808 054 2233. That's 0808 054 2233. Now, you have said any sight that is stolen by glaucoma cannot be regained. But once there's intervention, whatever is left can be preserved?
Exactly.
Does this person, after you've done the maybe surgery or given medications, let's even run through the treatment options. What are they like? You've spoken about lasers. You've spoken about surgery. Is there any other thing?
Yes, the mainstay of treatment is medical treatment using eye drops that reduces the pressure in the eye. But some forms of glaucoma will be treated with lasers.
Why? Why the difference?
Good. Now, remember, you need to, first of all, know the problem the patient has in the eye. That helps the doctor to determine the best way of treating the patient. For example, in a case like an angle closure glaucoma, the angle of the drainage of the fluid from the eye is blocked, is already closed. So the doctor...
Does that cause pain?
Yes. So when such cases of glaucoma will present with pain, excessive eye pain. So, but the doctor then decides to use lasers or surgeries to create another opening such that the fluid from the eye can drain through that opening and reduce the pressure in the eye. So most forms of glaucoma can be treated by medical therapy, laser therapy, and then surgical therapy.
Okay, we have a call coming in. Hello.
Hello. Good afternoon.
Good afternoon. What's your question?
Please, I just want to ask, how can someone prevent glaucoma in order for someone to have it in life?
Could you run through that again?
I said, how can someone prevent glaucoma in order for someone to not to have it?
Okay, I think you've already run through that. Thank you very much for that question, but quickly, let's repeat that.
Yes. Now, when you have someone in your family that has had glaucoma, so a family history of glaucoma, someone that is...
That raises a red flag.
Yes. Someone that, as we mentioned earlier, a black man, someone that is of older age, from 40 years or above, you should go for an eye screening by an ophthalmologist. And that is the only way you can prevent having glaucoma.
And how often should this screening be?
At least once a year or once every 2 years.
I'm laughing because, one of the indications is that you're black. So that nets all of us in.
Yes.
We all have to go once a year or once in 2 years.
Exactly.
Just to check and make sure everything is okay.
Exactly.
Okay, are there any lifestyle changes apart from going to the clinic that could help prevent glaucoma?
Exactly. There are other risk factors for glaucoma. One of them is diabetes mellitus. Another one is hypertension. Smoking has also been associated. People that smoke have a higher risk of developing glaucoma. Now, those risk factors, if you can eliminate those risk factors, your risk for glaucoma will be reduced.
Okay. Now, does it mean that if the pressure in the eye is not raised, there is no fear of glaucoma?
Thank you for that question. Now, there are some forms of glaucoma that, even though the pressure in the eye is within the normal range, the patient still has glaucoma, because it's not only a raised pressure in the eye that causes the disease. When there is an insufficiency to the blood supply to the optic nerve,
okay,
that's the nerve of the eye.
Let's quickly locate where this optic nerve is.
Okay.
Now, this is where we have the fluid, right? From your explanation.
Exactly.
And then it goes right down. We learned last week that the retina is right here at the back.
Exactly.
So where is the optic nerve?
Now, this is the optic nerve. Then this nerve connects the eye to the brain. So images seen by the eye will go through this nerve to the brain, where it is interpreted
Okay.
So what glaucoma does is to affect this nerve. It damages this nerve, and once this nerve is damaged, there won't be any communication between the eye and the brain. So even though the eye is
so it's a communication between the eye and the brain.
Exactly. So even though the eye is seeing, the brain can't see anything because the communication is lost. So
I believe we're having another call. Let's quickly take that before we continue. Hello.
Hello?
Hello. Could we have your question? Could we have your question? I can hear you.
All right. Good morning, ma'am.
Good morning to you.
Can you hear me? Okay, can you hear me?
We can.
Yes, I want the expert to explain how someone that has, that is myopic, that is short-sighted, can develop glaucoma. Because I heard it mentioned that short-sightedness is a risk factor for glaucoma. So I would like him to throw more light on that.
Okay, thank you very much.
Okay,
So can you, in simple terms, explain the mechanism that makes a short-sighted person more prone to having glaucoma?
Okay. Now, people that are short-sighted usually have a larger eyeball.
Okay,
so the
we
eye,
learned that last week.
Exactly. Is usually larger, and because it's larger, it's thinner. The wall of the eye is thinner.
Okay.
So now that means that the protection the wall of the eye gives to the optic nerve is reduced in people that are myopic. So when the pressure in the eye is elevated, so it will be easier for it to damage the optic nerve in myopic patients than in the general population.
Okay, well, that makes sense. And you said that it's a connection between the eye and the brain that now is compromised, and that's what affects the vision.
Yes.
Okay, now if somebody doesn't have high pressure in the eye, how do you detect the glaucoma early? Is it not by the pressure you knew, for example, that this is open angle or angle closure? So when there's no pressure, what hope does that person have?
Yes. Now, it would have been very wonderful if using the pressure alone we were able to detect glaucoma. But unfortunately, it's not so, because even a group of people with a normal pressure still end up having glaucoma. So the only way to detect glaucoma is by an ophthalmologist looking directly into your eye, doing what we call an ophthalmoscopy.
Okay, we'll continue from here. We're having a call. We'll come back to that. Okay. Hello.
Hello, good afternoon.
Good afternoon. Can we have your question?
Yes, I'm Patrick calling from Akwa. Actually, I'm having eye problem, like always, itching of the eyes. I'm always having itching of the eyes, and at the same time, I was scratching them from there, they go red. And at this level where I am right now, things are so hot, not so, the vision is very, very, low. I don't really see things very well, exactly. Except when I have to go on eye drop, like I'm using the same eye drop now without seeing a doctor because the magnitude of it is high. So I don't know, what can I do? Is there any tendency of glaucoma?
Okay.
What can I do now to get rid of these inchings and all those things?
Thank you, Patrick.
I don't know.
Yeah.
Any indication of glaucoma here?
Well, the best advice I'll give him is to see an eye doctor, because there are a lot of reasons why he can be having itching or redness. So it's until he sees a doctor that he will know whether he has glaucoma. He
also complained that he doesn't see so well.
Yeah, which is one of the features of glaucoma, especially when it is already advanced. So I'm not saying he has glaucoma, but he should see an eye doctor as soon as possible so that we'll really know what's wrong with him. Okay, so
he must have an examination for definitive diagnosis to be made.
Exactly.
Okay. Now, before that call came in, we were talking about the doctor looking directly into the eye to determine if there is glaucoma. Is there a picture you see that shows that there's glaucoma in that eye?
Yes. Now, when the doctor looks into this eye, the doctor is able to see the optic nerve directly.
Okay.
And then one of the characteristics of glaucoma is that there is a particular pattern of damage to the optic nerve.
So the damage can be seen.
Exactly. So the doctor will see what we call it cupping of the optic nerve. So the doctor sees it directly. Also, the doctor does what we call a visual field assessment.
And what's that?
Now, because we know that glaucoma starts by affecting the patient's peripheral vision, what we call the side vision. And the patient may have glaucoma and is still seeing very well, but the side vision is already lost. So the doctor does what we call a visual field assessment. That visual field assessment will demonstrate that the patient, even though he's still seeing, has lost
the vision
around.
Okay, but this, it strikes me that this is going to be very important for people who want to drive.
Exactly.
Do you get a lot of people coming for eye tests because they want to drive?
Yes. Well, I'll commend the Road Safety Commission because of late they have been advising patients that have problems with their peripheral vision to see the eye doctors. It's naturally supposed to be a prerequisite before you even obtain a driver's license, because apart from how well you can see, how wide you can see is also important, because if vehicles or people are on the side and you are not able to see them because you have lost your peripheral vision, it can even lead to road traffic accidents.
Okay, finally and very quickly, what are success rates like when you treat people who come early?
Wonderful. Now, for people that come early to clinic, it is very, very successful in the sense that their vision will be retained for the rest of their lives. They are at a lower risk of losing their vision once they come for treatment and once they are compliant with their treatment.
Thank you very much, Dr. Okeke. Thanks for coming.
Thanks
for being with us, and thank you for all those calls. It shows that you're following what's going on. Please take care of your eyes. I am Mary Alale Yusuf.